In the next few slides, we're going to be looking at the proximal end, the distal end, and the walls of the adductor canal. So the adductor canal begins at this point here. This is also the apex of the femoral triangle. And the femoral triangle is this area over here where the femoral artery, the femoral vein, and the femoral nerve can be found. So two of the boundaries of the femoral triangle are muscles that we've identified already in this video. And this over here is the proximal end of the sartorius. Medially, we have the adductor longus, and superiorly, we have a structure called the inguinal ligament. And to remember these borders, you can use the mnemonic SAIL, S standing for sartorius, A standing for adductor longus, and IL standing for the inguinal ligament. And the apex of this triangle, which we've identified already, is the proximal end of the adductor canal. So in terms of how the adductor canal ends, the adductor canal ends inferiorly and medially when it meets the adductor hiatus. And remember that the adductor hiatus is a space in the adductor magnus muscle between the fleshy adductor insertion and its tendinous hamstring insertion. So between the apex of the femoral triangle and the adductor hiatus, there's one more question we want to ask, which is what muscles make up this intermuscular passageway? In this image, the sartorius muscle has been removed, so we can actually see the length of the adductor canal. And again, here is the apex of the femoral triangle, and over here is the adductor hiatus. So this is the adductor canal. Let's talk a little bit about the walls of the adductor canal. And there are 3 walls of the adductor canal, and we can see 2 of them in this image. The posterior wall is made up of 2 muscles. And along the proximal part of the adductor canal, the adductor longus makes up the posterior wall. As we travel distally and the adductor longus ends, the adductor magnus is the posterior wall. The anterolateral wall is made up of 1 muscle, and that is this muscle over here, the vastus medialis. The remaining wall is the medial wall, or the roof of the adductor canal, and this is formed by the sartorius muscle, which we can see as it's placed back into anatomical position in this image. Since the canal runs deep to this muscle, it is sometimes referred to as the subsartorial canal. This image is a cross-sectional image of the thighs. And remember, when looking at a cross-sectional image, you have to imagine that you're looking up at the structure from the patient's feet. So over here is the posterior aspect, and over here is the anterior side. So that makes this the right thigh, and over here we have the left thigh. So this whitish structure, sort of in the center of the thigh, is the femur. And anteriorly we have the anterior compartment muscles. Over here we have the posterior compartment muscles. And finally over here we have the medial compartment muscles of the thigh. The muscles highlighted on this image are the vastus medialis muscles on each thigh. And remember that they make up the anterolateral wall of the adductor canal. Now what we can see highlighted is the posterior wall of the adductor canal, and this is in the proximal portion of the thigh, so this muscle is the adductor longus muscle. And finally, the muscle that's highlighted is the sartorius muscle, and this makes up the medial wall or the roof of the adductor canal. And of course, the reason we're looking at these walls is to find the adductor canal itself, which is here, running between those 3 muscles. If you found this quick anatomy or physiology video helpful, you'll enjoy our video tutorials even more. Click on the button and you'll see what I mean. We have hundreds of videos available to our premium members, not to mention all the fun quizzes, complete articles, and atlas sections to solidify your knowledge. Click on the button in the middle to watch the full-length video and master anatomy and physiology.